Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone. Welcome to today's professional. Today, Lima Dental Associates. So again, in the studio with us, Dr. Wesley Shankland. Hi, Doc. Good to see you again.
Good morning, George. How are you today?
I'm doing just fine.
Great.
Now, what would you like to discuss today?
I would like to talk about allergies and asthma. And I'm not talking about allergies to medication. I'm talking about seasonal allergies. As I sat in the parking lot when we came in here to the studio today, I noticed all the buds coming out on the trees. You know, in this month of April, things just, we'll look out there today and it'll be dark and dreary, and tomorrow we'll look out and these things will all be exploding.
Yeah,
and when they explode, the pollen fills the air. And I know a lot of our patients and people watching, myself included, are really affected by seasonal allergies. Probably 35 million or more Americans are. And here's the problem in dentistry. When one takes over-the-counter medications or even prescription medications from their physicians, most of these medications are made to dry up our mucous membranes in our noses so we don't have that nasal drip and the nasal congestion. But that specific kind of medication also affects our salivary flow in our mouth. So our salivary glands dry up, especially our parotid glands right here. So our mouth develops a condition called dry mouth.
Right.
Now, dry mouth is an uncomfortable problem. It causes terrible bad breath. It causes, or it contributes to periodontal disease. And most importantly, George, if one has a dry mouth, they can develop cavities, rampant decay real quickly. You see, our saliva was created to help cleanse our teeth. And when salivary flow stops, our teeth are not cleansed well to cleanse off drinks and foods and things like that. So if our mouth is dry, our teeth are dry, these particulate things stick to our teeth and produce acid, which the bacteria use to cause tooth decay.
Any suggestions?
Yeah, I have a lot of suggestions. The first is, if you use inhalers, make sure you rinse your mouth out well with water for about a minute and swish it around and swallow it or spit it out. Use a gum. All chewing gums produce salivary flow. I'd prefer you use one that has xylitol, which is a sugar, very sweet, very tasty, but we can't metabolize it, so we can't turn it into sugar, or to acid. Yeah. Also, brush your teeth faithfully real well several times a day, and make sure you brush before you go to bed, because that's when your mouth really gets dry.
No. Asthma attacks could happen while the patient is in the dental office.
In the office. That's why we have to know if you have asthma, we have to know the medications you're taking, so we know what is prescribed, not to counteract your medications.
And
keep smiling, keep sharing, and keep caring.
Thank you, Doc.
That's
our report today.